We are so delighted to welcome Mr. Christopher O'Donnell. Thank you so much for coming today. Could you please introduce yourself?
Sure. Thank you very much for having me along today. My name's Christopher O'Donnell. I'm a nurse practitioner and a director of nursing living in Queensland, Australia. I have two roles, I guess, at the moment. My first role is as director of nursing for innovation and practice. Um, Within Queensland Health, a large public health service in Queensland. So we have approximately 98,000 staff and look after 4.5 million people. So my role there is to advance nursing practice and to look at how we can innovate better serve our population. I've also have a background as a nurse practitioner, and in particular, my area of specialty is in emergency. So I'm taking some time away from my bureaucratic administrative job and doing some work within one of our hospitals, Queensland Children's Hospital, in the emergency department. So it's a great pleasure to leave the desk work behind and get back on the tools, so to speak, and be looking after some of our paediatric patients within the emergency department. So very exciting.
Thank you so much for sharing your rich experience. Do you have any specific interests right now, like field of research or your interest? Could you share some of that?
Yeah, absolutely. So some of my interests, I'm currently working through my PhD. I am I do have a great interest in health economics and also in how nursing can tie together the great value of nursing with politics and policy to really generate health outcomes for patients. So my interest is in particular in advanced practice and how we can use nursing to its full scope and to its full to unleash the power of nursing to really make change within our population. Certainly working across in the hospital, in the tertiary sector, but also looking in the secondary and in the primary sector. So looking at the care out of the hospitals and how the value of nursing can particularly be unleashed and how we can use nursing to really deliver value. I'm also involved in education of nurse practitioners and in the clinical education of nurse practitioners. I also have a role within the Australian College of Nursing. So I'm the state chair of the Australian College of Nursing in Queensland. I have the great pleasure of representing our state at the national level. And I'm also the chair of the community of interest within the Australian College of Nursing for advanced practice. And so with these roles, I get the opportunity to advocate for nursing in the political and in the policy stream.
Thank you so much for sharing. Like you have so many rich experience and critical roles. Oh, well, I'm curious to know, like during this pandemic, how did it look like in Australia? Could you share your experience or your views?
Look, I think in Australia we've been quite fortunate. When we realised that there was something coming in February, there was a lot of planning that commenced very quickly, and we stood up a response in Australia that, compared to a lot of other Western countries, we hit the virus response very hard, and so we went into lockdown in March. And essentially, we all began working from home if we were in office bureaucratic type jobs within government. And it was essentially only critical essential workers that were allowed out. So people working in hospitals and healthcare. We started delivering a lot of our healthcare over telehealth. And we began to, rather than having that face-to-face connection, began to look after our patients virtually, which presented some unique challenges for us within nursing, because we are a very tactile, hands-on profession. So suddenly, we then had to provide that nursing care from over the telephone or over a video conference. But look, nursing itself, I think, responded very well, and we were very, when we went into the lockdown, we didn't receive the numbers that we feared we would. And I think we were able to control infection rates very well. We were able to come out of lockdown, the full lockdown that we were in after a couple of months, and we've been able to control community transmission exceptionally well, to the point that it's almost zero at the moment. We do get some isolated cases here and there, and more often than not, they're related to people that are coming in from overseas that are bringing the virus in. So I think, by and large, we've been very lucky here in Australia compared to some other countries that I know have very much suffered with the virus. I know that Japan has had some challenges, but I think in the Asian bloc that we're all in, certainly including Australia and that Asia Pacific bloc, I think we've fared fairly well compared to Europe. And so one of the things that we did early on was we offered our support virtually to our colleagues in the United Kingdom and in Europe, and we have been doing various different podcasts and meetings online to help support our colleagues in Europe and in England. There has been some challenges, but I think we've faced them well, and we've really shown the resilience of nursing. Thankfully, because of our very firm lockdown and the firm rules that we had, and probably because we have the safety buffer of distance between our cities and our populations, we haven't had the infections that other countries have had.
Yeah, I'm so glad to hear that. In Australia, it wasn't like as bad as like compared to other countries, and also the technology has been a great method to connect with other countries and learn from each other, as you mentioned. So we're just focusing on leadership. So during this challenging time, from your perspective or from your research area, do you have any suggestions for how to enhance nurses' leadership during this very challenging time?
Absolutely. So I think we need to really begin to understand how we can influence at the national level. Well, not just at the national level, but also at our local levels. When crisis strikes, politicians and policymakers will go to the people who they think are the experts, the people that can deliver solutions for them immediately. So it's very important to have, to pre-plan, but also to get yourself out there as a trusted resource, someone that we know that can be relied upon to provide clear guidance. Now, in Australia and in the United States, we're very fortunate that nursing has been the most trusted profession for the last 30 to 40 years. And nursing was involved early on within the response that we had here in Australia. But even still, I think nursing can do a lot better in terms of how it can influence. And the one thing that we have learnt here in Australia is that the power of nursing to speak with one voice, it is very important. So I think the first thing is to really understand, in Australia, for example, the footprint of nursing is quite large. So health is the largest industry that we have in Australia. We make up around about 10% of our gross domestic product. And people working in healthcare and in social assistance industries represent around about 15% of our total workforce. And that's growing. And so we're very much a growth area. One of the challenges we're facing now is that our workforce is aging, and by 2030 there's going to be a shortage, based on our current numbers, of about 25%. So we're going to need 25% more nurses over the next 9 to 10 years. The other challenge that we've got is that for all of the health dollars that we spend, and in Queensland it's about $1 in every $6 that is spent on healthcare to some degree or another. So a lot of that is in labour costs. And nursing is seen to be around about 60% of total expenditure. So whenever we want to have workforce reform, often, and people want to cut budgets because of whatever reason, nursing is obviously seen as an area that they can trim straight away. The challenge for us is to really demonstrate the value of nursing. And if we can demonstrate that value quite effectively, it helps that argument. But demonstrating the value is only part of the issue. And I'll come back to how we can demonstrate that value. But before I do, I'll just talk about a couple of documents that we probably all should be aware of. And if you've been following the Nursing Now campaign, which everybody has, we'll all know about the Triple Impact Nursing Report. That was a report by the All-Party Parliamentary Group on Global Health, led by Lord Nigel Crisp. Really what this document showed was that by developing nursing, you improve both the health and the gender equality of nations, but we also support economic growth. So we're supporting the economic growth of the whole country because of the size of that footprint that we have. And as I said, in Australia, 10% of GDP, it's massive. And investment in nursing is investment in the communities that they serve. And I think the key thing that the report made, it was a very simple point, was that we can't have universal health coverage, and we can't have effective health coverage without strengthening nursing and without having a strong nursing presence. Now, nurses, we have traditionally, I think, been seen in some circles as being somewhat the handmaidens of healthcare. Certainly the handmaidens of doctors. And we've moved out of the shadows. We need to keep doing more of that. And we know that nurses cannot champion them by themselves. They need to have other people along. Nobody can champion their profession by themselves. Medicine can't do that. And I'm certainly in allied health can't. We need to get other actors, other people involved, politicians, non-nursing leaders. They've got to work with us to create some of the changes that we think we need to do. And so Lord Nigel's Triple Impact Report recommended that we need to develop nurses in leadership. We need to enable nurses to work to their full potential. But we also need to collect evidence, promote partnership with our colleagues outside of nursing, and we need to act on it because it's critical that we build upon the evidence that we have. So research is critically important, but it's disseminating that research and getting that information out there. We have seen some areas where we've had evidence and it hasn't been acted on. And so we knew the impact, if we look at the United Kingdom, they had some reports were done in the late 90s that looked at the development of the modern matron and the power of nursing. But then with the development of the targets that were brought about in the early 2000s, which saw increased pressure upon nursing to really focus on the numbers of patients that were coming through. We saw issues like happened at Staffordshire Hospital with the Mid Staffordshire inquiry, and I'm sure you've all heard of the Francis report that occurred there. But what it found was that if we don't empower nursing and we don't give nursing the right voice and the right governance, the whole health system can fall down. So I guess for me, it's very important to really understand the policy cycle and to understand the politics of nursing.
There's like so many important messages that like resonated to me, like especially for the collective voice. I totally agree because with individual, like the power is like, limited, but if like we gather together, then we have like nurses can be empowered and like we can change the world with involving politics and economics with other fields. So yeah, thank you so much. And I especially love the part of demonstrating the value of nurse. And yeah, this project main target is about that. So yeah, thank you for pointing that out. Then finally, could you give us a message to nurses and nursing students who will become future leaders in the society?
Absolutely. What I'd say to you, the future leaders, is really focus on shouting from the rooftops the amazing work that you're doing. We were talking before about the policy cycle, and we were talking about how the work that we do, the work that we do needs to be seen, be really appreciated. And what I'd say to you is that you don't have to be the leadership that you provide isn't about the job title that you have. You don't need to be a director of nursing. You don't need to be the head of a health service or a minister of health to make real change. You can be a registered nurse on a ward who's generating data, who's publishing that data, who's being a clinical leader, someone who's developing the evidence and shaping the evidence. And as long as you're getting that information out, that is critical. So what I would encourage all of the nurses listening is to tell your story and tell the story that your patients, that your patient, I guess their journey. So explain what their journey is. I would then think about the problems that you're facing, think about the issues that you're facing. And I really like the Clingden multi-streams approach, which really ties together three streams. It ties together the problem stream, the policy stream, and the politics. And we need to become the best thing that you can do for your profession and for your patients and the communities that you look after, is to really understand how the clinical practice of nursing, policy of nursing, and the politics of healthcare all tie together. So the sort of things that we can do is about writing letters and making contact with your politicians, organising nursing into a tight, cohesive unit, getting involved with your local nursing organisations, your local nursing colleges. Think about how you can generate buy-in, how you can pitch this message so that it's important to politicians, make them interested, make them want to help you, and start leading the way. Nursing can deliver a very effective, very cost-effective service, and we can see that in Australia. That for Australia, it's value equals quality. So the quality of the care that we provide over the cost. Now, we know that nursing does cost less than some of our other colleagues in other health professions, but our quality is far higher in some cases. In fact, there's bounds of research that show that nurse practitioners, when they're compared to contemporary models, like medicine, they can provide the same level of care and the same quality of care far more cheaper and far more flexibly. And with higher patient satisfaction. So the evidence is out there for us to be able to do these things. We need to get in there and do these things if we want to give our patients the care that they deserve. And I guess the four things that I would leave to you, these are the strategic challenges And I think a gentleman by the name of Jeremy Schiffman, he identified these four strategic challenges. First one is problem definition. Understand what the problems are that we need to develop and get internal consensus. Get your colleagues to understand what the problems are and what the solutions are. The second thing is positioning. You've got to portray the issue in ways that inspire your external audience to act, give them a reason to help you. Number three, coalition building. You've got to forge alliances, both within and without, outside the healthcare system. And governance, establish institutions to facilitate collective action. So in Australia, for example, we have 7 states in Australia. If we were to take the vote of our nurses, that would be the equivalent of one of those states. So that would be the equivalent of Tasmania or the Northern Territory and the Australian Capital Territory combined. So they have a massive voice, but they don't speak as one, and we need to start speaking as one. So what I would say is build coalitions, get everybody together on the same page and act as one, because you have the size of the footprint of nursing can influence and can change governments. We can make governments change and change their opinions. So I think that would probably what I would want to leave for future generations.